Urinary symptoms: UTI, urinary tract infection. It feels like I'm passing shards of glass, and there is a constant stinging burn every time I try to go.
Provider response? That sounds very painful. I'd like to start with a UA urinalysis and a urine culture today. To identify the specific bacteria causing this, so we can prescribe the right antibiotic. We will need a clean catch urine sample.
Kidney stones. I have this sudden, agonizing pain in my lower back and side that comes in waves and makes me feel like I need to vomit.
Provider response. The waves of pain you're describing are classic for renal colic, which literally means kidney pain. We need to order a non-contrast CT scan immediately to check for a stone and see if it is obstructing the ureter.
Prostate issues, BPH. I've noticed that my urine stream is very weak and it takes a long time to get started, especially at night.
Provider response. These obstructive symptoms, especially nocturia, are common as the prostate enlarges. I will perform a digital rectal exam, DRE, and order a PSA, prostate-specific antigen, blood test to evaluate the gland.
Kidney infection, pyelonephritis. I have a high fever and a deep, aching pain in my mid-back that won't go away no matter how I sit.
Provider response. A fever combined with flank pain is a serious sign. This could mean pyelonephritis, which is a serious kidney infection. We will run blood work to check your white blood cell count for signs of infection.
Bladder infection, cystitis. I feel a constant heavy pressure in my lower abdomen and an urgent need to run to the bathroom every 10 minutes, but only a few drops come out.
Provider response. This frequency and pressure are common with cystitis. Are you also experiencing any suprapubic pain or noticing any cloudiness in those few drops of urine?
Hematuria, blood in urine. I was shocked to see that my urine looks pink or tea-colored today, even though I'm not in any physical pain.
Provider response. Even without pain, hematuria, blood in the urine must be investigated. We will need to schedule a cystoscopy to look inside the bladder and an imaging study of your upper urinary tract.
Overactive bladder. I'm having a hard time making it to the restroom in time lately. The urge hits me so fast I can't control it.
Provider response. This sudden urgency is a hallmark of overactive bladder. I'd like you to keep a bladder diary for 3 days to track your fluid intake and the timing of these episodes.
Incontinence. Whenever I cough, sneeze, or laugh, I find that I'm leaking a small amount of urine involuntarily.
Provider response. This sounds like stress incontinence, which occurs when physical pressure is put on the bladder. I recommend pelvic floor exercises, such as Kegel exercises, and working with a physical therapist for bladder control.
Prostate enlargement. I have difficulty urinating. I wake up at night to urinate. My bladder does not feel empty even after urinating.
Provider response. These obstructive symptoms, especially nocturia, are common as the prostate enlarges. I will perform a digital rectal exam, DRE, and order a PSA, prostate-specific antigen, blood test to evaluate the gland.
Dehydration/concentrated urine. My urine has become very dark yellow and has a strong odor that I haven't noticed before.
Provider response. This often indicates concentrated urine due to dehydration. How many ounces of water have you been drinking daily? And have you had any other symptoms like dizziness or a dry mouth?